Welcome back to the deep dive. You're here, like us, because you want to get smart fast.
Absolutely. Straight to the point.
And today, you've asked us to look into AI in healthcare, specifically diagnosis and treatment predictions.
Yeah, a really hot topic. So much happening there.
We'll cut through the noise, we're asking.
Hmm.
Just how accurate is AI diagnosis right now?
Uh-huh.
Can it spot diseases earlier than we can? How is it helping doctors with treatment plans?
Good questions.
And the big one, AI versus human specialists. Where does personalized medicine fit in?
We should definitely touch on ethics too, and how this AI actually learns.
Right. Ethics, training, and, could AI replace your doctor, even in mental health?
And are there rules for all this?
Yeah.
Regulations.
Exactly. Lots to cover, but we'll keep it focused. Let's dive in. First up, accuracy. How good is AI, really?
Well, it's interesting. AI can be incredibly accurate for very specific tasks. Think analyzing retinal scans for diabetic retinopathy.
Okay, like pattern recognition on images.
Precisely. In those narrow fields, it can sometimes match or even exceed top specialists. But
But
diagnosing complex conditions with lots of symptoms, maybe conflicting information, that's still very much where human expertise is vital.
so great for specific tools, but not replacing the detective work of a broad diagnosis just yet.
Not yet, no. The holistic view is still key.
Makes sense. What about spotting things early? You hear a lot about that.
Yeah, that's one of the most exciting areas. AI is fantastic at sifting through just enormous amounts of data.
More than any human could manage.
Exactly. Millions of records, images, looking for tiny, subtle patterns that might signal early-stage disease.
Like what kind of diseases?
We're seeing real promise in detecting certain cancers earlier from scans, sometimes before a human eye would catch it. Also things like predicting heart attack risk by finding tiny anomalies in patient data over time.
Wow. Flagging risk years ahead.
Potentially, yes. It's about identifying those almost invisible warning signs.
That could be revolutionary for prevention. Okay, so it spots problems. How does it help doctors decide what to do? Treatment planning.
So AI can take a specific patient's history, their genetics, lifestyle factors, and compare that against huge databases of treatment outcomes from millions of other similar patients.
Right.
It helps suggest which therapies might work best for that individual, maybe even optimal drug dosages. It's about leveraging big data for personalization.
Okay, personalizing the plan. Which leads us to that comparison. AI versus human experts. Is one better?
It's less about better right now. It's more about different strengths. They complement each other.
How so?
Human specialists have years of experience, intuition, empathy. They understand the person, not just the data. AI can't replicate that.
True.
But AI processes data at a scale and speed humans just can't. Finds patterns we'd miss. So the best results often come when they work together.
A collaboration, then. Makes sense. Let's talk more about that personalization. How's AI making medicine tailored just for me?
It really digs into your unique profile, genes, lifestyle, history, everything, and uses that to predict your specific disease risks and how you, personally, might respond to different drugs or treatments. We're moving away from one-size-fits-all.
Towards something much more targeted. That sounds incredibly powerful. But how does the AI learn all this? The training?
It's a bit like teaching, but with data. Massive amounts of medical data images, notes, research papers, all labeled correctly.
Labeled?
Yeah, so the AI knows this image shows cancer, this patient responded well to drug X. It learns patterns from these labeled examples.
Okay.
And it constantly refines its understanding based on feedback on its accuracy. It learns by, well, doing, but with data.
Got it. Data-driven learning. So the million-dollar question, could AI replace doctors, radiologists, GPs?
It's unlikely to be a full replacement anytime soon.
Okay.
Certain tasks.
Sure.
Analyzing scans in radiology, for example, AI can automate parts of that.
Augmentation, not replacement.
Exactly. Think augmentation.
Yeah.
The complexity of patient interaction, ethics, nuanced judgment calls that still needs a human. Empathy is crucial. Roles will change, transform, but outright replacement, probably not in the near future.
That's reassuring for many, I think. What about a sensitive area like mental health? Is AI used there?
It is being explored, yeah, for things like analyzing speech patterns or even text messages, looking for signs of potential mental health conditions.
Really? From text?
Yeah, language patterns can be indicative. There are also AI chatbots being developed for initial support or guidance, connecting people to resources. It's still early days, but the potential to increase access is there.
Interesting. Okay, last point. With all this tech, are there rules? regulations.
Oh, definitely. Regulatory bodies globally are working on frameworks. Much like new drugs or medical devices, AI tools for healthcare need to be proven safe and effective.
So there's oversight.
There is, and it's evolving rapidly as the technology does. Ensuring patient safety is paramount.
So wrapping up, AI is clearly making waves in healthcare. Faster analysis, maybe more accurate in places, definitely more personalized potential.
Right. But it's not magic. It's a tool, best used alongside human expertise with ethical guidelines.
A powerful tool, though. And for you listening, here's something to think about. As AI gets more woven into your healthcare journey, how might your role as a patient change? How do you want to interact with it?
Yeah, a fascinating question for the future. Definitely keep an eye on this space.
We certainly will. Thanks for joining this deep dive.